Okay, hello everybody, and welcome to the last and final session of our online workshop series on the environment and women's health. My name is Dr. Laura Brown, and I am an ESRC postdoctoral fellow in the Department of International Development at the London School of Economics, and I have co-organised these workshops along with Dr. Elaine Flores from the Centre for Global Mental Health, which is a joint collaboration between the London School of Hygiene and Tropical Medicine and King's College London partners. We've organised these workshops with the help of our wonderful team of project assistants. So that's Billy Turner, Valeria Flores, and Natalia Zuniga-Albildo, and also the invaluable help of LSE's Global Health Initiative Events Manager, Chanel Nunes. So this workshop series is supported by the ESRC, so that's the Economic and Social Research Council in the UK, and the London School of Economics Global Health Initiative, as well as the British Society for Population Studies. Before we start, there's a few housekeeping points to make for today's session. So we are recording this workshop and we'll make some of it available on our website at a later date. We will be monitoring the chat, and anyone posting inappropriate content will be removed. Related to this, please do not share the link via social media. And also it's advisable to close all non-essential applications, especially apps like Skype, because these can be interfering. Your microphone should be muted. Please type any questions that you have for the presenters in the chat function. And if you experience any connection problems, try turning your webcam off, as this can help. The participants icon should open up a panel on the right of your screen where you can interact with the hosts. And the chat function will open up another panel where you can enter questions or request technical support. If you want to ask a question to one of our speakers, please ensure you select to everyone so that your question is visible. Please also note that we have English and Spanish interpretation available today. So all our presentations will be in English, but if you need to hear the Spanish version, please use the interpretation function at the bottom of your screen, and you can mute the original audio.
So today's session will run as follows. First, we will have 6 10-minute presentations, and then this will be followed by an audience question and answers. We will be hearing from, first, Chantal Victoria Bright, who will be presenting Inside Hanjay, teaching children through literature about environmental health risks associated with drinking water access in developing countries. Then will come Antonella Bancalari, who will be presenting challenges to adopting public infrastructure, experimental evidence from urban slums. Then David Astudillo-Rueda will be presenting post-traumatic stress disorder, food insecurity, and social capital among mothers after the 2017 coastal El Niño flooding in Piura, Peru, a mixed method study. Then Annel Rojas Alvarado will be presenting persistent post-traumatic stress disorder and resilience in people affected by El Niño coastal phenomenon 2017 in Lima, Peru. Mikaela Patrick Winnie Chelagat will be presenting planetary health justice for women, examples of practice from design, participation, and ecofeminism. And lastly, myself and Laura Brown, we will be presenting Is Gender on the NGO Agenda? Preliminary findings from interviews with women's organizations in Peru. These presentations will be back to back, and then we will be following by a question and answer session. So please enter your questions in the chat box as you think of them, and Billy will direct them to the relevant speakers. So over now to you, Natalia, to introduce our speakers.
Thank you. First up, we have Chantal Victoria Bright, a PhD candidate in water security and environmental peace building in Liberia at the University of Manchester. Chantal, over to you.
Thank you. Sorry. There. Hello, everyone. The name of my presentation is Inside Hanjay, teaching children through literature about environmental health risks associated with drinking water access in developing countries. Meet Janje. She's 8 years old. She lives in a town in Liberia with her mom, a part-time cook, her dad, a traveling trader, and her 4-year-old brother, Jojo. She's smart, adventurous, loves papaya pie, and she also shares responsibility with her mother in collecting clean water for the household on a daily basis. And this is what the plot centers around. Janje represents so many 8-year-olds or children her age around the world. The story is basically about Janje when she decides to play a little longer than she normally would after school with her friends and neglects to collect water in time for her family. So basically, instead of going to her normal water resource, she instead goes to one that's closer because the one that she normally goes to is too far away. And she wants to go to a location that is closer because she spent so much time playing after school. And then basically the story unravels because the water source that she chooses to go to has contaminated water. As you can imagine, this is a very heavy topic for children to comprehend and understand. So I had to engage the story with a lot of humor and also with some local language to make the story more authentic to the Liberian setting. I wrote Janje for a lot of reasons, but one of the reasons is to teach environmental consciousness on global water issues to children. It's also a very cheeky way to carry out the message across to adults as well, because, for example, children engage with adults once they read books. So not only when they're fond of a book or passionate about a particular topic, but also for clarity. Therefore, when they go to their parents to discuss the topics, they'll also force parents to go and research the topic as well. And that brings more light to the clean water issues around women and girls. So on the screen right now is the 2 covers of Janje. The first one to the left, which is the English version in the original cover, was published in 2017. And then to the right is the French version, which was translated and published by the US State Department, and it's being used around the world to teach environmental education in French and in English, but it's specifically targeting French-speaking countries. Okay, so women and girls are disadvantaged. This is just some stats on water security around the world. 785 million people in the world do not have clean water close to home. 2.3 billion people don't have a decent toilet of their own. Globally, 31% of schools don't have clean water and 34% lack toilets. Particularly for women and girls, 1 in 3 women lack safe toilets, which is a huge problem for that time of the month. 1.25 billion women and girls lack safe and adequate sanitation. And of those, 526 million don't have a toilet at all. Women and girls are responsible for finding water for drinking, cooking, sanitation, and hygiene. Women and girls are estimated today to spend over 200 million hours collecting water. Now, this is especially a big deal now during the pandemic when we rely on good hygiene to help prevent the spread of the virus. So you can imagine for an 8-year-old little girl or even having that burden on children, collecting water and that responsibility is a huge deal. I just wanted to highlight 2 important dates that's celebrated annually. World Water Day, which is on the 22nd of March, and World Toilet Day, which is the 19th of November. World Toilet Day doesn't get as much attention as World Water Day because no one really wants to talk about sanitation, but water issues and sanitation come hand in hand. This is just a snapshot of the research around children's literature and environmental awareness. This is just a small snapshot. So some of the main points that's come out of the studies are evaluation on how the environment is represented in children's literature and the extent to which children's literatures meet the goal of environmental education, how green literature could help to encourage children to get closer to their environment, children literature as an important tool for education and sustainability and the environment. Here is a collage of some of my favorite children's book that discuss the environment. Dr. Seuss is a pioneer in introducing children to environmental issues. His classic novel is Dolorex, which has a film adaptation. Another one of my favorite books is The Water Princess, which also discuss the author's real life experience of collecting water. And which brings me to a close. So I will be writing a second book, to a sequel to John Jay, which is going to discuss sanitation. Like I mentioned before, it also goes hand in hand with clean water issues. So that should be coming out later on this year. I wanted to take this opportunity to thank the London School of Economics for inviting me, Dr. Brown and her team as well, and look forward to receiving your questions.
Thank you so much, Chantal. Next up, we have Antonella Bancalari, a PhD candidate at the Department of Social Policy in the London School of Economics and Political Science. So we are ready to hear you, Antonella.
Hello, thank you very much for the invitation to present this research joint work with Alex Armand and Rita Ausberg. And this is a project of the Institute for Fiscal Studies called Challenges to Promoting Adoption of Shared Infrastructure Experimental Evidence from Slums of India. So our study focuses on sanitation in slums of Uttar Pradesh. An investment in water, sanitation, and hygiene infrastructure is paramount to attain the SDG 6 of clean water and safely managed sanitation. Particularly, community toilets have been constructed by the government in order to improve sanitation conditions in slums where there's limited space to provide in-house sanitation facilities. Yet in this context, we find that there is rampant free riding in terms of paying for the services of community toilets and a remarkably low valuation for this shared facility. The average respondent is willing to pay just below 27% of the official rate to use the community toilet. Thus, community toilets are of very poor quality in terms of the infrastructure, the cleaning status, and the presence of harmful bacteria. So now it is important to think about community toilets in, sorry, I'm gonna share this full screen. So now it's important to think about community toilets and sanitation through the gender lens, because women have greater biological needs and face more psychosocial stress in regards to addressing their sanitation needs. So due to these issues, there has been a growing push to consider sanitation as a right for women. Now, in the presence of this social norm, non-payment for usage by women can affect infrastructure quality, which can hamper environmental quality even further in slums and generating health and productivity costs for everybody in the community. So there's a trade-off there. What we find is that, indeed, non-payment is more common among women and willingness to pay is lower. In the left-hand side graph, you can see the distribution of users that pay across community toilets. And we can see that there is around 30% of the community toilets 0 women pay for using it. There is variation. On average, 50% of the users, of the women users of a community toilet, pay for it. But you can see that the distribution is much more skewed towards the left compared to that of men that tend to pay when they use the community toilet. On the left-hand side, you can see the distribution of willingness to pay for community toilet use. You can see that both men and women have a very low willingness to pay for using the community toilet of 0 rupees, or between 0 and 1 rupee when the official rate is 5 rupees. But even though it is a bit more similar, women are still have still a lower willingness to pay of an average of 1.3 rupees. So in order to break this vicious cycle of having non-payment, which on its own affects the quality of the service, and when the quality of the service is poor, in turn this affects the evaluation of the community toilet, and then in turn this affects the payment for the community toilet, we implemented a randomized control trial in 2018 in 110 community toilets and their catchment areas, so the households within the area around the community toilet. And we randomly allocate these catchment areas to receive either a supply push plus campaign, or a control. The supply push consisted mainly on the improvement of the community toilet infrastructure and cleanliness conducted by the NGO Finnish Society. And we did it through a grant scheme where we offer caretakers of the community toilet to either select repairs for their community toilet, a deep cleaning of the facilities, or cleaning agents and tools, plus training of the cleaner. Now, the supply push plus campaign, in addition to the improvements in the community toilet quality, we offer a house-to-house information campaign aimed at generating awareness of the importance of payment and the negative externalities resulting from unsafe sanitation behavior. Finally, those catchment areas allocated to the control receive no intervention. So this allows us to estimate the effect of providing this external push to the shared infrastructure and see how this affects the environmental quality and the behavior of people. So this is an example of the intervention, particularly the deep cleaning. This is to the right-hand side. You can see how a dirty community toilet looks like. So nobody obviously wants to use that toilet. And these community toilets are not only not paid for, but also underutilized. And people continue practicing open defecation in these urban areas. To the left-hand side, you can see a community toilet that has been cleaned through the grant scheme. Okay, so we collect one baseline round, and then we have 3 follow-up rounds at the household level, plus 5 follow-up rounds at the community toilet level. And particularly, we collect a series of outcomes that I'm going to focus on today. And the main one is the willingness to pay for using this toilet. And we do so, we elicit the willingness to pay of potential users by utilizing a multiple price list incentive compatible method, offering a bundle of 10 tickets to use the community toilet versus cash. So we say bundle of tickets or 0 cash, and then bundle of tickets or 10 rupees cash, bundle of tickets 20, and so on. So the willingness to pay is the switch in which the participant prefers taking the cash rather than just a bundle of tickets to use the community toilet. Then we measure attitudes to pay as an index that is capturing whether the respondent believes that users should be paying for the community toilet service. So basically that operation and maintenance of the community toilet should be paid using the user's fees, or instead of an external agent, so the government or an NGO. We also collect data on the demand for public intervention using a behavioral game, in which we ask respondents to complete an anonymous card in which they can select the most pressing issue in their community that they would like to communicate to public officials. And then we are communicating this to the local officials of Uttar Pradesh. We also collect data, observed data on usage and payment during the lapse of 1 hour in a random day at dawn when traffic is at its peak in the entrance of each of the 110 community toilets. In total, we have a panel data set of 1,500 households in 110 community toilets. So now I'm going to show you what happens. And basically, an external push to the quality of community toilets, instead of increasing the valuation and promoting demand for it, it actually backfires. So what we observe is that willingness to pay is lower, and the quality of the community toilet, even though it improves and it is perceived by the users, this worsens the attitudes to pay and increases the demand for public intervention, driven mainly among women, who are the ones that are basically where the social norm of non-payment is more prevalent. Now, we do find also, as I said, that there's a greater demand for public intervention, meaning that now women are more likely to report as the most pressing issue in their community toilet that the operation and maintenance of it should be done by the government instead of other issues in their community, such as trash collection. Thank you. I'm finishing. Such as trash collection, no jobs, or, for example, bad roads. How we interpret this is as a crowding out. So once there's an external push in improving the quality of the shared infrastructure, when I say external, I mean an NGO or the government, this means that the people now are less likely to contribute privately, and they would like for this external push to continue over time and them having free access to these community toilets. We also find that this external push decreases usage among men, mostly, but this is important because if men are not using the community toilet, are more likely to practice open defecation, and this is affecting environmental quality. In the longer run, it does increase payment. However, it's not socially desirable that this is done at the expense of decreasing usage. So, some policy implications and further research from our study. The first thing is trying to understand how can we effectively break the vicious cycle of low payment and low quality of shared sanitation infrastructure. And further research is needed to answer this question, and we provide 3 key areas to focus on. The first one is understand which other cost-effective policy options we have to achieve sustainable improvements in environmental quality. There are some studies that are focusing on the effectiveness of enforcement, but if you enforce payment, that can, as I showed, that can crowd out the usage, and that's not socially desirable, mostly in an overcrowded place like urban slums. You don't want people not using the toilet because they're not able to pay it or they don't want to pay it and going for open defecation. So other options are fully subsidizing the services in the longer run and making sure that the government can actually make these, keep these over time. Or another option could be providing cash transfers to the poorest ones that are not able to pay and have a lower willingness to pay in order to promote payment. Another key area to focus on is to investigate how to change the social norm, making free rider in city usage and open defecation acceptable. We show that our information campaign, even though it was very intense and frequent, was not effective at changing the social norm of non-payment and free riding. And third, it is necessary to explore technologies that make public infrastructure excludable. So in this sense, that rich people that are actually able to pay for this are not using it for free. And that way we can make the link between payment and supply, make it possible to bring back this link. So thank you very much. In my website, there is a draft of a working paper of this study, and I'm looking forward to your questions.
Thank you so much, Antonella. That was really interesting. Next up, we have David Astudillo-Rueda. a senior medical student and trainee at CI Emerge, the Center for Research on Emerging Diseases and Climate Change from the National University of Piura, Peru.
Thank you. I'm very grateful to present this study here, and this study arises in expectation of a potential coastal event that occurred in the summer of 2017. During January and February, the north coast of Peru experienced intense rainfall, landslides, and flood, and Piura was the most affected region in northern Peru with intense rains and flood. But probably the most devastating event was the flooding by the river Piura, which affected much of the urban and rural areas of Piura and Quetzal cities. As a consequence, it left about 330 people affected and 92,000 people who had to be relocated in shelters. Also, Piura region had a social impacts in multiple domains, allowing the loss of the most important economic activities such as agriculture and trade. This is one of the shelters in Quetzal district where the people were relocated. And here we can see the largest scales of floods in Piura, Castilla, and Quetzal districts, and the urban rural areas affected. In order to understand the impacts on mental health and social context in the post-disaster scenario, we conduct a study to measure post-traumatic stress disorder, security, and social capital. And we evaluated the mothers enrolled in the El Niño cohort study, which is a pediatric cohort aimed at evaluating the nutritional impacts before, during, and after the cause of El Niño. And these mothers were enrolled in 3 cohorts, approximately every 6 months since the first months of 2016, in the delivery room of the main hospitals of Piura. And this study had a baseline assessment and 2 follow-ups in each cohort. An assessment was carried out 3 months after the floods, and the follow-ups were carried out 8 and 11 months after the floods. And to measure these outcomes, we used these instruments through a structured surveys, and these instruments were validated in Latin American context. We initially measured this result through a scorecard, and then we categorized them. And also, to capture the qualitative context, we conduct in-depth interview others who developed the post-traumatic stress disorder and severe food insecurity. The most of them were between 20 and 30 years old and has 2 children. 64% of them complete high school or technical education. Close to 1/3 of them live in Piura district, and over 50% of them live in houses built with brick walls and calumet roof, and only 8% of them have a continuous supply. Over 70% of them use gas for cooking, and had a color TV, and 36% had language connection, and over 60% of them breeds animals. This is where the places where we conduct the in-depth interviews and surveys. This is a farmer community district, Catacaos, and this is where the outskirts of Piura city. Within the mental health impacts, a decrease of PTSD prevalence and related symptoms over the follow-ups. And during the investment, the PTSD prevalence and related symptoms were high, but then during the first follow-up, they decreased considerably. And finally, approximately 1 year after the floods, they were virtually zero. Despite this virtually zero, within PTSD domains, the avoidance, numbing, and dysphoria domain remained slightly high, even approximately after the floods. But in general, all its domains followed the same trend of the PTSD prevalence. In the similar way to
David, please can you try and talk a little bit? David,
security had a high prevalence.
David, sorry to interrupt you. Please can you try and talk a little bit more slowly because the interpreters can't keep up with the translation. A little slowly.
Oh, yeah.
Thank you.
In a similar way to the PTSD prevalence, severe food insecurity had a high prevalence 3 months after the floods and then decreased consistently over the follow-ups. On the other hand, the prevalence of food security security was very low during the baseline assessment. However, it was progressively increased over the evaluations. During the food insecurity assessment, their item score dropped from high to lowest score approximately 1 year after the flood. In this part, it's especially important to look at qualitative data because several mothers reported that they went to sleep with hungry for several days after the floods, and also reported that they had only one meal a day. 3 months after the floods, the mothers decided to involve in groups for supplies, emotional, or knowledge support. The most of them sought individuals for support. And in addition, high social capital increased from a slightly high prevalence in the baseline assessment to remain highly constant in the follow-ups. The most of them joined food supply groups and received emotional support from religious groups. Although the mothers were not affiliated with any health, water, or electricity groups, they received learning support from them. During 3 months after the floods, the mothers were primarily supported by relative and religious neighbors and friends. So it's important to consider the impact on mental health after the low mortality disasters. Likewise, it's relevant to continue research on post-traumatic stress disorder because there are reports of chronic post-traumatic stress disorder even after 4 years from a disaster. And it's likely that exposure to previous El Niño event influenced the rapid recovery of mental health through resilient mechanisms. Currently, it remains important to assess the food security status of people affected by the El Niño coastal event. It's likely that high cognitive social capital has helped to decrease of post-traumatic stress disorder, reducing individual coping efforts and psychosocial resources. To conclude, our study, we found high impacts on mental health and food insecurity. The family and religious groups were important resources of social capital, and cognitive social capital increased rapidly after disasters, and rapid recovery based on high community resilience. These were MRG team. Many thanks.
Thank you very much, David. Next up, we have Annel Rojas Alvarado, a Peruvian medical student and trainee at CI Emerge, the Center for Research on Emerging Diseases and Climate Change from the National University of Peoria. Please, I will appreciate it. The next presenters can speak a bit slow so our interpreters can help us. Thank you so much.
Thank you very much. Hi, everyone. It's a pleasure to me to present this study about chronic post-traumatic stress disorder and resilience among people affected after El Niño event on 2017 in Carapongo, Lima, Peru. Oh my God. Okay. So it's known that the impact of natural disasters on the lives of women is different from other groups of a community. Which vulnerabilities do Peruvian women face? Economic vulnerability is the first, as they are working as non-professionals on retail commerce and agriculture, one of the lower paid sectors of the economy of Peru. Especially in rural areas, girls have shown higher levels of dropout, being teenage pregnancy one of the most common reasons for dropout. The socially determined gender roles also prevent women from having same liberty as men of migrating to look for work following a disaster. Also, when they are displaced to shelters, they have a higher exposure to sexual and domestic violence, and gender roles systematically exclude them from participating in disaster reduction policies. All these vulnerabilities give women a limited recovery capacity following a disaster. And this vulnerability creates stress and anxiety, and as a result of a natural event, effects on psychological health can be short-term or long-term, like PTSD and depression. being female gender the most common risk factor for developing these mental disorders. On the image on the right, we can see a female-headed family who lost their home after El Niño floods in Carapongo, Lima, Peru. Where is located Carapongo? Carapongo is a low-income peri-urban zone located in Lurigancho-Chosica district in Lima, capital of Peru. Here, most of women are householders and they dedicate their time for home maintenance and food production. They have also an increased susceptibility to negative health-related status. Between 2012 and 2013, there was an important gendered approach intervention due to the high vulnerability Carapongo have to the occurrence of disasters. We can see on these pictures, the main problem of Carapongo is the informal occupation. As we can see, most of houses were built on rocky areas with the risk of falling stones and rocks, and they are near to the Rimac River basin, near to rubbish and waste. So this project has the main objective to improve awareness and knowledge among people, among more vulnerable people, especially women, about the geodynamic hazards they have. So between February and April of 2017, coastal El Niño dramatically affected the coast of Peru. And on March 16th, Guaycoloro and Rimac rivers flooded Lurigancho-Chosica district. Carapongo was one of the most affected areas of the outskirts of Lima City. Preliminary results of studies in mental health, which were conducted in Lima, showed a prevalence of 21% of PTSD 1 year after the disaster. So in this context, we aim to assess the association between resilience and chronic PTSD development, doing a follow-up to people affected by coastal El Niño event in Carapongo, Lima. In this map, we can see that Carapongo is located on the right bank of Rimac River Basin. The circles represents the most critically affected areas of Carapongo, and the triangles represents the shelters that government established there in Carapongo. This other picture shows a temporary shelter where people were waiting for food the months following the disaster. This was a cross-sectional study where we assessed 150 residents affected by El Niño event, which were previously included in another mental health study conducted by Emerge Research Unit 10 months after flood. This study reports an interim analysis, so there is a sampling in Piura not conducted yet because of COVID-19 lockdown. The enrollment was at participants' households during January and February of the current year, approximately 3 years after the event. For data collection, we evaluate outcomes of PTSD, resilience, social capital, food insecurity, excessive substance use, depression, and anxiety disorder. We used this validated surveys, and for PTSD, we initially evaluate this variable as a quantitative one, and then we categorized it as present and absent for the data analysis. The socioeconomic status and demographic show that 79% of people were women with a mean age of 43 years old. 42% were housewives, 39% completed high school, and 17% completed technical education. Most of households were built with bricks and calamine, and the main water source was water well. Only 0.7% had continuous in-house water supply. About the daily living conditions we assessed, we found that 64% had no sewage connection. Also, we found that 72% bred animals. About the stress factors we assessed, we found that history of mental illness was reported at 5% of total population, that 40% of people suffered from physical injuries due to floods, 1% lost their family members, and more than half of them lost their homes and were displaced or relocated to shelters after floods. Surprisingly, 85% of them are now living in the flood place of residence despite the home damages they suffered. So 3 years after the event, we found a prevalence of chronic PTSD of 8%. We identified people with resilience, about 60%. 40% had moderate food insecurity. Cognitive and structural social capital were reported at 70% and 50% respectively. Also, 6% had moderate risk of tobacco use. 24% had moderate to severe depression, and 12 and 5% had moderate and severe anxiety, respectively. We found differences between prevalence of PTSD, of chronic PTSD, among those who had no sewage connection, those who suffered from physical injuries, those who lived in a new home after floods, and those who were diagnosed with anxiety and disorder and depression. Excuse me. The likelihood we found of having chronic PTSD were higher among those without resilience, also higher among those participants with low structural social capital, greater among those with depression and anxiety disorder. So mental health in Peru has been long stigmatized, and the availability to mental health resources are very limited, especially during and after natural disasters, and even more in the provinces of Peru like Carapongo. So some studies have shown that only 18% of people with moderate mental disorders receive treatment in Peru. The first 1 to 2 years after a disaster, the PTSD prevalence is ranging from 5% to 60%, similar like the results we found among inhabitants after natural disasters. And previous literature have shown that 30% of cases of PTSD will take a chronic course. In our study, we found that chronic PTSD among women from Carapongo have been associated with the inability to meet daily basic needs, the need to be relocated to shelters, and the delayed government response.
Annel, you have 2 minutes.
Okay, thank you. Also, we found that people identified with resilience were not at lower risk of developing chronic PTSD, despite it has been demonstrated as a protector factor. Also, social capital that we understand as social relationships and participation community networks that an individual have increases resilience capacity, adaptation, and recovery after disasters. Women from Carapongo showed high levels of both cognitive and structural social capital, but these were not statistically significant. After Ica earthquake, another study conducted in Peru showed a prevalence of chronic PTSD of 30% 4 years after the disaster. And they found also that high cognitive social capital decreased the likelihood of developing PTSD. Women from Carapongo need to be more involved in leadership positions. It's not possible that they have had only one intervention, and this was approximately 7 years ago. Government needs to do more social interventions to help them to decrease their vulnerability and identify their specific needs to frame disaster risk reduction policies. In conclusion, at least at this point of our interim analysis, we did not find an association between resilience and chronic PTSD, but we know that resilience is associated with PTSD. Chronic PTSD was associated in our study with moderate and severe anxiety and depression disorders. Timely address mental health disorders based on population mental health risk factors may mitigate the impacts on inhabitants and foster a rapid recovery. Thank you very much.
Thank you, Annel. That was an interesting presentation. Next up, we have Mikaela Patrick and Winnie Chelagat. Mikaela is a researcher and architectural designer working on research around inclusion, gender, and planetary health in the built environment. And Winnie is the co-founder of Maternal Aid for Mothers in Africa.
All right, hello everyone. Thank you so much for having us here today. So my name is Mikaela. and we're here today to present our recent work on a design approach for planetary health justice. And this is a framework that developed out of a collaboration between MAMA, Maternal Aid for Mothers in Africa, an NGO in Kenya, and STEMA, a health research organization. So it's our position that climate justice and health justice are intimately connected. And both of these are mediated through the environments in which we live, so therefore they're also questions of spatial justice. We propose that ecofeminism offers a philosophical approach to thinking through these interconnected challenges and conceptualizing how the oppression of the environment is interlinked with the oppression of women throughout history. Our intention is to apply some of the principles of ecofeminism to design approaches for addressing health challenges for women. This helps us to think about relations between interconnected problems, think through different systems, and think across different scales. To contextualize this, we'd like to talk through one of our case studies, which is a recent project in East Pokot, Kenya. I'll also share the link to our paper that goes a bit more into the theory for anyone who's interested to learn more about that side of things. And now I'll hand over to Winnie to introduce the case study.
Thank you. Thank you, Mikaela. So I'll go straight ahead with just to explain, or rather give a context of or a background of East Pokot. So East Pokot lies in Baringo County in Rift Valley. It is a semi-arid area with hot and dry climate. Temperatures average between around 34 degrees Celsius, while rainfall, like any other semi-arid area, is low, erratic, and unreliable. Maternal mortality in this county is one of the highest in Kenya. At least 375 women out of 100,000 women die while giving birth, and 31 infants out of 1,000 born die during birth. This is associated, of course, with limited health facilities in the area and poor road infrastructure, making it difficult to access health services in the few facilities that are available. Someone said that climate change affects the people who have least contributed to it, and this is very true when it comes to East Pokot, because over the years the area has experienced prolonged drought that has caused the death of people and livestock. And livestock is the community's main source of livelihood and food, because it is a pastoralist community. And most recently, flooding has also become a significant problem on health, water, and food security. For example, last month, one person died, families were displaced, and property destroyed when the area experienced flash floods, which swept through the area. This is becoming a common trend, unfortunately, and the same effects are being felt and seen with Lake Baringo, which is a few kilometers, are about 124 kilometers from where we work in Orus, where in the past months, more than 30,000 residents have been displaced owing to the rising levels of the lake, and the lake is the second largest after Lake Turkana in Rift Valley. With the recent floods, for example, roads, bridges were washed away, and this cut off the community from the main center of supply, which is Marigat. So what this means is that the community could not access food supplies, could not access basically any supplies, medical supplies that would generally help the community to survive. And in the community that we work with, women are the ones who bear the children, they raise the children, they feed the families, they clothe them, they build the houses. So with this cut of supply and all these challenges that come as a result of climate change and changes in the environment, it puts a strain on the family, and especially the woman, and who most of the times will end up being on the receiving end. So we've seen so many cases of domestic violence. This has always been the trend, but the cases go up when there's a crisis. Next slide, please. So our initial purpose when we started MAMA was to promote health in the community. However, because we adapt a participatory approach in all our projects, with continued dialogue with the community, it was apparent that we could not ignore other environmental, social, economic factors that the community experience. So we evolved our mandate, or rather our core purpose, to not just promoting health, but to promote health, to promote wellness, and to promote socioeconomic strength, because all these things tie in together for us to create a community that is functioning and that is sustainable. So one of the things that we conceived was to create a center. So like I said initially, the idea of having a building was to have a place where we could coordinate all our activities with community health volunteers and all our health training and promoting, like I said, health. But this has evolved to not just a place to coordinate health activities, but a place where we can promote wellness, a place where we can train the community, and also have a resource center where they can get information on even what are the best ways to adapt to these changes, and what are the best what are the new methods that you can promote, make sure that your livelihood is sustained in terms of taking care of your livestock. So I'll hand over to you, Mikaela. Thanks.
Right, so I'll just talk a little bit about how we go about designing for a kind of a design brief like that, which is quite challenging. So firstly, why does participatory design matter? Well, it's our position that those who are most affected by the challenges that Winnie has just described should be at the heart of the design process. And one of the things that shows that is actually the building at which this photograph was taken, which is taken at the site of an abandoned health centre that was built in the village of Flores. Now, this health centre was built without consultation in the community, without, I think, sufficient feasibility studies. So there's, a concrete building has been put up, but it's never been used. It's not in a location that's desired by the community because it's too public facing. So it's never been used, and it's actually regarded with suspicion in the community now. So how do we then do participatory design? It's something very difficult, I think, and to do true participatory design is always a challenge. So we try and embed some of the philosophies of ecofeminism into our design and research methods. This means listening, making and holding space, so allowing for conversations and storytelling to manifest in a somewhat organic way. In East Pokot in particular, this also means working really closely with our local mama team who are based in the community, getting community permissions for the activities we want to hold, and working with brilliant local translators who can facilitate dialogue. It also means building connections, sharing stories, songs, and joy, and trying to have some fun at the same time.
Ella, you just have 2 minutes.
Perfect. We also need to understand the material and resource constraints in the community. So what resources are available, what materials for construction are available, what environmental factors we need to consider, and also how people live their lives, how they want to occupy space. So to do this, we've also been doing some participatory planning on site, working with the local mama team to understand what site constraints there might be, and actually drawing on the land to say, well, these are the things that we need to be considering. I'll hand back to Winnie just to talk a bit about the kind of final vision and what Mama's doing now.
Yeah, so finally, thanks, Mikaela. So putting all these things into perspective, what we're doing now is actually, we've started the design process and the pre-design process of the center, and what we've really considered is, like Mikaela said, what are the local materials that we can use, what does the community need, what other purpose can we serve aside from just having a center that serves the health of the community, and most importantly looking at the environment. How are we going to create a place where it's going to be sustainable and withstand whatever environmental crisis that is going to come. And so that's where we are at now, and we are just working together, continue to working with the community to make sure that we create a space that is functional and serves the community. Thank you.
All right, I'll just quickly loop back to the original brief around designing for planetary justice by, say, showing this table, which is basically setting out some of the design challenges that the MAMA project is looking to address. So it's important to think about the design challenges, then what activities the design should allow to take place, what design processes we might want to embed to identify the right solutions, and what components of design that might involve. This might also mean changing the design as we go, because we'll be working in a participatory way. So I think that wraps it up. You can have a look at the table here for yourselves. But we'd like to thank Laura and everyone for inviting us, and we're looking forward to the discussion and hearing what everyone has to say. Thank you.
Thanks, Mikaela and Winnie. Last but not least, we are going to hear from Laura and Elaine.
Hello all. So we will be presenting the preliminary findings from a qualitative research study that aims to explore the current third sector gender environmental health landscape in Peru. So Peru houses around 55 indigenous groups with 48 different indigenous languages. Also, Peru is a country exposed to recurrent natural and man-made hazards. On top of that, Peru's economy is also highly dependent on extractive industries. And despite its importance, social conflict in the producing communities has been a recurrent problem. 80% of total environmental social conflicts in Peru were related to the mining sector. So our literature review of the academic research has highlighted an apparent lack of gender and intersectional focus in environmental health research in the country. There is also a lack of gender and ethnicity disaggregated data in official statistics and research studies. So we wanted to explore some of the reasons for this.
So to do this, we conducted online research for suitable organisations. The inclusion criteria were they had to be an NGO, they had to focus on women and/or environmental issues, and they had to be working in Peru. We then systematically ranked these potential organisations and sent out recruitment invitations. Our study was approved by ethics boards in Peru and in UK. So far, we've conducted 6 semi-structured interviews. These have been on Zoom in Spanish, and we were talking to heads or theme specialists in the different NGOs. The interviews lasted about an hour, and we've been analysing the findings with a thematic analysis approach. Here we can see some of the demographic characteristics of our interviewees. They were aged between 31 and 60 and had between 9 and 30 years experience in the sector. Most were in relatively high up positions in their organisations, and their backgrounds were a mix of environmental, health and social science training. The NGOs covered Peru and focused on different regions in the country. One of the NGOs was a Peruvian branch of an international organisation. These NGOs were female biased, which made sense given that their focus was on women's issues. So in this quote, this is illustrated nicely. So one participant says, "We are in a very sexist country where decisions are normally made by men. So having an organization where decisions can be made by a woman gives them, women, many opportunities to want to work here." Some of the organizations mention diversity in their staff too. For example, "We are mostly women and diverse, and I think they're hoping us to find some form of support."
So our interviews describe a large range of environmental issues, highlighting how these were context specific across the different geographies of Peru. For example, illegal mining in the Amazon, the freezing temperatures in the Andes, and flooding and landslides on the coast. Many of the interviewees also mentioned the detrimental impacts of destructive industries. Climate change was yet another major concern, as can be illustrated by this quote. "The climate is not like before. Now it is crazy, it has changed. Now it burns us more. Now we feel more freezing. Now it hits us more." Also, water availability and contamination were key concerns, as was COVID-19, but also broader external threats and contextual issues that were already in place before the pandemic. So related to vulnerable groups and vulnerability, it was clear that environmental threats, such as climate change, would have a differential impact. For example, this quote, so climate change is not a neutral phenomenon. It is a phenomenon that affects men and women differently, with women being the most affected. We all feel cold, but the way it affects us and in what conditions it finds us is very different for each group. With organizational focusing on women, most of the interviewees mentioned women as being vulnerable, but also differed in which groups of women they focus on. Indigenous populations were also identified by most interviewees as being particularly vulnerable. Several interviewees expressed concern that vulnerable groups were invisibilized and their needs not being addressed. So the pandemic by COVID-19 was also a hot topic. And one of the key current environmental threats identified by our interviews has been highlighting this invisibilization issue. Also, we need to keep in mind that on a per capita basis, Peru has currently the highest level of coronavirus deaths globally. So COVID-19 has affected vulnerable groups more heavily, but the interviewees pointed out that we need better disaggregated data to be able to highlight this and to address this issue. COVID-19 has also interfered with their program's deliveries. The organizations have been able to adapt to technological provisions, but this also creates inequalities in the access. COVID has also increased environmental awareness, for example, of air pollution in the cities. So therefore, COVID is adding another layer of stress to an already complex and unequal setting.
Peru has different geographical contexts, but there are important micro contexts within these. Human trafficking around illegal mining areas is a good case in point, as is exemplified by this quote. So those activities, especially extractive ones, worry us too much. Apart from polluting ourselves, making our bodies sick, making Mother Earth sick, it also promotes corruption, promotes trafficking. So trafficking creates particular pockets of vulnerability for women. It's not just those who go to work as waitresses or escorts around the mining areas, but it's also for the families of the miners who relocate with them. So one interviewee told us about a study that they conducted comparing the reproductive health outcomes of escorts in mining areas with the wives of miners. They found no difference in reproductive health outcomes, quite surprisingly, but women who were housewives felt actually more victimized than the other women, than the escorts. And perhaps this is because they have to live with their aggressors, so there's no freedom from victimization for these women. Aside from environmental threats and localized differences in exposure and vulnerabilities, broader contextual issues and external threats interplay with women's environmental health, such as machismo, conservative influences, and structural corruption. The dual role expected from women, not only to do domestic work, but to manage the farm when the husbands migrate out for labor, leaves them burdened, undervalued, and undertrained. Some of the organizations we spoke to have been thinking of ways to address the machismo culture and the gender differences in education. For example, by providing agricultural training for female farmers and involving men in projects to increase support of women's initiatives and create new forms of masculinity. This corruption affects cross-sectoral collaboration, as does a lack of interdisciplinarity, intersectorality, and high staff turnover, as is demonstrated in this quote. You have to do a lot of advocacy work to be able to move forward and to generate changes. And this advocacy process is a job that you have to do permanently. With the replacement of officials, each change of government, doing all the steps and advocating again. This is a continuous process. And in some ministries in Peru, because they change the minister a lot, that sometimes causes delays. Some interviewees also identified aspects which helped collaboration, such as having direct relationships, built on reputation and trust with transparency and accountability?
The general consensus amongst our interviewees was that a gender scope needs to be more thoroughly applied. For example, across research projects, but also in community processes like environmental certification related to extractive industries. That will be illustrated by this quote. So many times there is a count of how many women are participating, but it is very quantitative. There is not really a measurement of how is the quality of participation or of the opportunity of participation or on the decision making. So interviewees pointed out that strategic tools do exist, like, for example, the National Plan of Gender and Climate Change, but also that they are not fully implemented. And another topic that we found across the interviews were that the interviewees were quick to blame the responsibility related to environmental threats and its consequences on other organizations and sectors. So also this blaming game is familiar from my PhD research, which looked at mental health consequences of El Niño flooding in the coastline of Peru. In this research, everyone blamed everyone else without pointing out their own individual responsibility for ameliorating these types of impacts. So what we found was that there was a clear parallel with interviewees in this study, where the main responsibilities were shifted to the public sector, to the extractive industries, and to the illegal economies. We would like to hear what the public sector has to say as well.
So we will be interviewing ministers from related ministries to try to understand if and how they apply a gender scope in environmental initiatives and to compare and contrast the sector priorities and responsibilities. We will also triangulate our findings with a policy document analysis. So thank you for listening. We are actively looking for participants and research assistants for this next step of the research, so please do get in touch with us via our website if you'd like to be involved. Thanks very much.
Thank you very much, Elaine and Laura. Now over to Billy, who will be hosting the Q&A session.
Hi everyone, thanks to all the presenters for your really interesting presentations. We're going to move on to the discussion part of the session. And we've got some questions that have come up in the chat. If people have more questions, please continue to type them. So we'll begin with a question to Chantal from Mahuli. She says, thanks for your presentation. What policy can be envisaged by African states to address the issue of water shortage in urban areas and its impact on the situation of women and girls? That's for Chantal. I think you're on mute, Chantal.
Yeah.
Yeah, perfect.
Sorry about that. Yes, thank you for your question. That's actually a very complicated question because it really depends on the government and how it's structured. Because in many cases, with like water initiatives and policies, has a lot to do with the private sector. Because in some of the poorer areas or some of the developing countries, a lot of these issues are addressed with outside financiers. And so the policies reflect that. In some cases, there are some aid that is given to specific countries that is used and helps implement the sorts of policies. So it's a little bit of a complicated question, but yeah, I think that's all I can really say about that. I don't know if anyone else want to jump in.
Thank you, Chantal. We're going to try and do one question for each speaker just to try and make sure everyone has time to say something, and then we'll come back with second questions if we have time. So for Antonella, what are your thoughts on maintaining levels of sanitation where policymakers consider it too expensive? And is there a balance to strike to show the benefit?
Yeah, that's an important question. I would say in Spanish, lo barato sale caro. So what is cheaper at the end is more expensive. So in this case, for example, because it would be too expensive to connect every household to sewer systems and their in-house toilets, they invested in public infrastructure that at the end suffers from coordination problems. So whenever there is a cost effectiveness analysis or cost benefit analysis to understand which is the best policy solution, I think policymakers not only run with the fact that they want to minimize costs, but also the fact that benefits are not tangible in the short run, mostly linked to sanitation and public health. These are long run benefits that people may not consider as a priority due to this present bias. So I think there's a matter of increasing the importance and the salience of sanitation for public health and trying to understand from all the different sanitation solutions which are the most appropriate and the most cost benefit for different areas, considering urban slums, just in general urban areas and versus rural areas.
Thank you, Antonella. Okay, we're going to move on quickly to David. David, can you provide some specific local examples on the mechanisms that social capital would be influencing mothers' mental health from Puera? And that's for David.
During the months after the disaster, many mothers joined to food supplies groups such as Envaso de Leche, where the community members provide food supplies to prepare the main meals for all of them. And food, economic and emotional support among many people in the community helped to overcome with the critical situation in the post-disaster scenario. It helped to decrease the individual coping efforts. Yeah.
Great, thank you. For Mikaela and Winnie, oh no, sorry, I missed out Annel. We'll go with Annel first. So we had a question from Antonella for Annel, which was, how do you measure PTSD and depression and anxiety?
Many thanks for the question. For time reasons, I didn't be able to explain more about how we measured the outcomes. So for PTSD, we used a validated survey. This was the checklist civilian for PTSD. These have been validated in the Latin American context, and these have three principal domains. First of them is the trauma re-experiencing. Then we have the trauma avoidance, and then we have the hyperarousal domain. And first, we have this as a quantitative variable, and those patients with a score higher than 43 points were identified with chronic PTSD. About the other outcomes, for depression, we use the validated survey of Patient Health Questionnaire 9. It's a questionnaire with 9 questions about some criteria about depression, where people have to answer about some adverse situations and how they reacted to them. And then we have a total score of 27 points, and then we categorized it. For anxiety disorder, we use the anxiety disorder questionnaire. It has 7 questions, and as depression have a total score of 21 points, and then we categorized it. All of the surveys were validated in Latin American context.
Thank you, Annel. For Mikaela and Winnie, we have a question. There must be barriers to the involvement for some members of the community. How do you ensure equity and participation? And how do you make sure the relevant people are involved and their voices are heard?
Thank you for the question. It's a really good one, and I think one that you have to kind of constantly be reflecting on. I think we didn't have so much time to go into it, but in the process of engaging with the community, Winnie has been working with the community for a long time, and one of the key things for the design activities in particular was making sure that we got permission from the appropriate people to be there so that everybody felt safe and able to participate. So we had to get permission from the community elders in order to host the activities, and that was kind of one step to ensuring everyone felt comfortable to participate. Winnie, I don't know if you want to add a bit more, as you have a much closer relationship with Helen and the team in Oris.
Yes, and also just making sure that all the different groups were in an environment or a safe space where they felt they could contribute. For example, we took the women, we had a talk with the women separately, just so we could really have them comfortable to speak in situations where they wouldn't speak if the men were there. That's probably the only thing I could add.
Thanks to both of you. Okay, lastly, before we go to a second question, hopefully we've got time to squeeze one in. For our hosts, Laura and Elaine, how do you harness ideas about how to foster collaboration to create sustainable change? And how does the quality or quantity of collaboration participation impact this?
I guess I can go first, and then Elaine, you can contribute. So I think I actually asked the question about participation there to Mikaela, because I think that's an important aspect of this, is getting relevant stakeholders involved in participatory project design from the beginning. So whilst you want to be involving the communities that you're working with, it's really helpful, I think, to have input from people at different levels who will help make those projects successful. So it's all fine and well to just work with the community, but without the kind of political will and the advocacy and even like the research support to get things going, then perhaps those things don't get sustained. So I think for Elaine's and mine sort of future project ideas, this is like the beginning step of that. It's trying to understand collaboration across sectors so we can learn from those gaps and try and fill those gaps in to build fruitful collaboration, fruitful participatory projects. Elaine, I don't know if I've hit the nail on the head or missed anything there.
No, actually, I think that one of the things that related to the context, for example, in Peru, I would say that we lack a lot of civil society participation. And this lack of engagement, fueled by many contextual factors there, not only pushes forward like, for example, you will only be trying to see for yourself, your family, but will not be able, or you will not be thinking that much into how to collaborate and engage with your community, and also to foster new relationships with your local authorities, as you will have distrust mostly. So I think that not only collaboration, but also community empowerment and those working hand in hand can make sustainable change and the changes that we will need.
Thank you. Okay, we're going to see if we can get a few second questions in before time runs out. So we'll go back to Chantal. How could these children's books that you were talking about be used in schools, making environmental consciousness part of the curriculum for primary students?
Well, it actually, Janje, is used in some contexts. Is incorporated in some curriculum, some private primary schools in Liberia, and also through the French edition through the network of the U.S. State Department, which facilitates a network of schools. But it can be, that really depends on the individual local education programs, like what they decide to put in their curriculum. I usually help facilitate how to get the physical books to the schools, but it's usually decided within the local authorities. Thank you.
Thank you. Moving on to Antonella. Are there any other examples you have considered that could trigger behavioral change to sanitation?
I actually replied to that question just in case I didn't have time in the chat. So I'm going to read out loud my reply. So most of the evidence on how to change behavioral behavior linked to sanitation comes from rural areas in Africa and Southeast Asia on the effectiveness of community-led total sanitation campaigns. This CLTS mostly relies on social emotional triggers of shame linked to practicing open defecation in a village, mostly when latrines are available or when the village is making a compromise to actually build the latrines and use them. So for example, my colleagues at the IFS found the CLTS is more effective at changing sanitation behavior in poor areas. So basically those areas that would need it the most. And my research in Pakistan shows that follow-up activities after CLTS are effective at sustaining behavioral change over time. So this goes back to the first question in terms of cost-benefit policy solutions. So whenever you are aiming to change sanitation and environmental quality, it's not only about the supply, but even when toilets exist, you need to promote demand. You need to make people actually use them. And there's very little research on evidence based on a context such as urban areas in which the community sense is not that present. People do not collaborate that much with their neighbors. So this is an active research area to try to understand what happens in urban areas, peri-urban areas, and particularly in slums. Well, this is basically what our research tries to fill a gap in.
Brilliant, thank you, Antonella. Thank you. David, we have a second question for you. Considering the aftermath of the post-disaster setting in Piura, will there be any changes on the assessments of the cohort participants to complement any other factors that would be impairing mental health in the mothers?
Excuse me, can you
repeat the question?
Repeat me?
Yeah, sure. So considering the aftermath of the post-disaster setting in Piura, will there be any changes on the assessments of the cohort participants to complement any other factors that would be impairing mental health in the mothers?
Yeah. It's important to assess the chronic impact on the mental health and in the affected people. And we should probably measure resilience and social support, that is individual ability to use their interpersonal relationships to overcome difficulties. In fact, Annel is currently running a cross-sectional evaluation of post-traumatic stress disorder, depression, anxiety, and resilience and other factors, and soon to evaluate the affected population in Piura.
Thank you, David. So for Annel, we have a question from Giulietta Chaparo. She would like to know how the people who participated in your study speak about emotions and effective responses to the disaster. She says that your framework is heavily based on psychological frameworks such as PTSD, but I wonder what we are missing here, imposing those categories onto people's experiences. And she wonders about the translation processes between how people talk about their emotions and the PTSD framework, or how do you classify emotional responses as anxiety or PTSD?
Okay, thank you. It's a very good approach. Yes, we did a qualitative approach, a qualitative analysis, and for that, as I said, there were some depth interviews for people with higher scores of PTSD. So we evaluate the experiences of people by trained anthropologists using a phenomenological approach by breaking down interviews on transcendental, essential, and central issues and recomposing them into categories on the subjective and social reality of the people interviewed. So we perform several coding. It was a process. We first perform a prioristic coding, and after that we perform an empirical coding, and after that we define new categories using axial code to identify the relationship of the topics to each other. And finally, in this population we find two principal themes for the persistent PTSD experiences that were memory and experiences, and two for resilience experiences. These were recovery and struggles and persistence of symptoms. That's what we found.
Thank you, Annel. I hope that answers your question, Julieta. So I think we have time for one more for Mikaela and Winnie. We've got a question about what is next for the programme, and do you think that this could be rolled out effectively as a model for other local communities to benefit from your learnings and your research?
Winnie, do you want to take that one?
Yeah, so we've been doing continuous monitoring and evaluation. So we just want to measure impact, see what the lessons that we can learn from it. And yes, the reason why we're doing it is because this is a pilot for us, and we intend to have it as a model that can be replicated in other areas similar to East Pokot. And the other thing that is next for Mama is that we want to do a community project, income generating project, beekeeping, because honey from the area is the best, and it's the perfect environment for it. And also I feel like bees are, I don't need to say more. So yeah, that's what next for Mama. Thanks.
Thank you. Brilliant. Well, thank you to everyone for all the questions and answers. It was really good to be able to have a bit of a discussion. And I'm going to pass it back to Laura now to wrap up the session with a few last words.
Okay, all I really want to say is a big thank you to everybody. So thank you to today's speakers and our participants for such great discussions. And also thank you to my team, the ExWH team, and the interpreters for your help running this event and the others in the series. It's been great meeting so many people who are interested in women's environmental health issues, and we would love to stay in touch. Please keep an eye out on our website, because we'll be putting the recordings of the 3 sessions up there, and also we'll be putting project updates and network updates there. So thank you, everybody. Goodbye. Have a good evening or a good morning or a good afternoon. Thank you. Bye.
Gracias.